are challenging budget times, but following years of deep and meaningful reforms, I am pleased to announce that Governor Patrick has been able to make significant investments in health and human services in this fiscal year 2014 budget. These investments will help us to implement the governor's health care reform law, enhance our public health oversight, and strengthen our safety net programs to help our most vulnerable residents. This budget proposes new tax revenues, which are essential to achieving all of these objectives. Additional revenues will support high-yield public investments in healthcare, education, transportation, and innovation. Funding these key investments will keep Massachusetts growing, helping our students, families, and businesses to compete in the 21st century global economy. The FY14 budget maintains a strong foundation of public investment that already made us national leaders in student achievement, in health insurance coverage, veteran services, and providing a safety net for our most vulnerable citizens. As you heard, MassHealth provides health coverage to low-income individuals of all ages and to people with disabilities. We cover 1 out of 5 Massachusetts residents today, and we will cover approximately 200,000 additional residents in 2014 when we implement the coverage expansions that are part of the Affordable Care Act. One of these expansions will affect childless adults with income over 133% of the federal poverty level, who never previously had access to these services. Drawing on ACA funding, Governor Patrick's budget increases the MassHealth budget by 13%, which allows for 325,000 members to be eligible to enroll in MassHealth's new benchmark coverage program through increased eligibility under the ACA. This figure includes members currently enrolled in Commonwealth Care, the Medical Security Program, the Health Safety Net, as well as some new enrollees who will be new to coverage even here in the Commonwealth of Massachusetts. Many of the patients whom you all serve every day will gain access to coverage for the first time in 2014. I expect that we will be asking for your help to make sure that they understand how to apply for MassHealth coverage. Our mission at MassHealth is to improve the health outcomes of our diverse members, their families, and their communities by providing access to integrated healthcare services that sustainably promote health, well-being, independence, and quality of life. It is very important to us, as it is to you, to ensure that residents of the Commonwealth have access to healthcare, including family planning services. As a primary care physician and as someone who used to work in reproductive health as well, I know that these services empower individuals to not only take care of their clinical health care needs, but also to have more control over their own life planning and goal setting. We understand that for many young people in the Commonwealth, family planning clinics may be their first and only access point for comprehensive medical services. We see the family planning clinics that we work with as our partners on the front lines, providing needed screenings and follow-up for a variety of health issues. You and your providers are in the forefront of healthcare transformation, and we hope to partner with you as we work to roll out our medical home efforts. The medical home model may not have directly affected your clinics thus far, but we will be working with you to ensure widespread adoption over the next several years as we roll out our primary care payment reform. As many of you know, the ACA not only provides ways to expand the number of people who receive health insurance, but it also provides opportunities to expand the range of services we can offer. Included in the ACA is a new family planning state plan amendment option that would allow us to seek federal approval to provide limited family planning services to all men and women with income up to 200% of the federal poverty level. Possibly extending these services to individuals who might not otherwise be eligible for comprehensive MassHealth coverage. This option would also protect privacy and access for all individuals seeking confidential family planning services. My staff is closely examining this option, and I expect that we will be consulting with you as we continue this process. We know that making key investments in the public's health will ultimately help the Commonwealth to control rising healthcare costs, but we need to make sure that we are paying for these investments in a fiscally responsible way. The Patrick Murray administration has made great progress in healthcare reform and cost control, but even with these reforms, the state budget is challenged to meet our obligations to protect our most vulnerable residents Each of us has a stake in our future, and each of us should contribute to paying for it. I ask you to join me in support of the governor's budget for investing in these important services and balancing the approach with a comprehensive revenue proposal. As you continue to advocate for these family planning services this legislative session, and as we continue to implement the Affordable Care Act and Chapter 224, our new health reform law, I just want you to know how much we appreciate your continuing efforts to provide comprehensive family planning services for all of the Commonwealth's residents, but particularly for our underserved residents in the MassHealth program. We know that your efforts make a tremendous positive difference in their